Mwana Amani Isa has just come across a mosquito breeding site at a homestead in Kenya's coastal town of Malindi. She's a mosquito scout and often goes out to neighborhoods looking for signs of the insects. If left to mature, the larvae will develop into mosquitoes that can transmit diseases like malaria or elephantiasis.
There are many mosquito larvae here, and since the tube they breed in is not a permanent structure, the water will need to be poured out. The owner says the water is for his livestock. He needs to pour just enough for the cows to drink, so that there is no water left.
I had a problem with my well, so I decided to use those bathtubs to store water for my animals. I didn't know that mosquitoes were breeding there. I now know how to prevent this.
According to the World Health Organization, malaria claims about 1 million lives worldwide every year. Majority of victims are aged below 5 years and live in sub-Saharan Africa. Mosquito scouts like Mwana Amani are trying to change this. She's a volunteer with Puma, a group started in 2006 to get communities to clean up their surroundings and help control malaria. In town, Mwana Amani sprinkles some bacteria to help destroy larvae in a blocked drain. She says, though, that the trash will need to be removed. Mwana Amani's work is already having an impact on some residents here.
It's good to see the mosquito scouts working here, because some people don't understand the importance of keeping their environment clean. Everyone must chip in, because the municipal council cannot serve all parts of Malindi on their own.
She's taught us how to keep our surroundings clean and cover water drums to prevent mosquitoes. We've managed to control mosquitoes here because of Mwana Amani. Malindi town is found along the Indian Ocean coastline, and the warm and humid conditions here make it perfect for mosquitoes to thrive. There are now over 250 trained mosquito scouts in the town who are sponsored by donors to serve about 50,000 residents. The scouts have also been able to help researchers like Dr. Charles Mbogo map out areas with mosquitoes and find ways to get rid of them. Dr. Mbogo works for the Kenya Medical Research Institute and says he's been recording fewer malaria-infected mosquitoes over the last 4 years.
We have good achievements in this particular aspect, as we have been able to reduce mosquito populations in Malindi, or upper Malindi, by about 70%. And the malaria cases have also gone down by about 60% also in the same area. I would attribute this maybe to the programs that are going on, scaling up of ITNs or long-lasting nets in the communities, telling them exactly how to use them, and also level control that we are also putting in. We have also been putting in environmental management, which the people actually do the work themselves by removing those sources of mosquito breeding sites.
After field work, Mwana Amani meets her colleagues at the office to discuss their findings today and the solutions they plan to implement.
Nilipata kuna kisima kwa mzee fulani hivi kule Muyeye, ambaye hicho kisima anatumia tu maji yake, anachotea ng'ombe wanakunywa. Anachota kwa kisima, anaweka kwenye madude ambayo ng'ombe wanakuja wanakunywa pale. Lakini hicho kisima nilipata kina mbu wengi sana. Sasa ile ningetaka nilete kwenu hilo ili tushauriane tuone ni kitu gani tunaweza fanya pale mahali ili wale mbu wasizaliane pale.
Wajulisha hata hii suluhisho ambayo tuko nayo, kwa sababu hata sisi wenyewe tunajua wazi ya kwamba hii dawa ambayo huwa tunatumia kutreat haya maji hawana side effects kwa wanyama ama kwa binadamu, ni vile tu yanaua umbu, na sidhani kama atakataa.
Scientists in the continent are still working on a malaria vaccine that can eventually eradicate the disease. If successful, Kenya hopes to roll out a vaccine by 2015. At the Malindi District Hospital, health workers say that they have seen a significant drop in the cases of malaria treated here.
On average, we'd say 1 to 2 patients a month. That's if you look back at our records, as I said, we do mortality and morbidity. We have 1 to 2 confirmed cases. We find the majority of the cases actually there are no malaria parasites which are seen. And we have complete confidence in our laboratory and the results that they'll give us. So from that, we have only 1 to 2 confirmed cases. And usually with the appropriate medication, majority, if not all, go back home cured.
Use of treated bed nets is also being encouraged as efforts to reduce mosquito populations continue. But even then, some people often find other ways of utilizing the distributed nets, making it difficult for mosquito scouts to work efficiently.
Haya ndio matumizi mengine ambayo hayastahili ya neti kutumika.
This is how some people misuse the nets. They say they don't like the quality of these nets, that they are rough. So it's used to protect their chicken from birds like hawks. This is very bad.
The mosquito scouts are working on plans to replicate the program in other parts of the country because they believe this will give Kenyans a better chance at fighting and even eliminating malaria. Efforts to control the disease in Malindi have already made a significant difference, and perhaps this model can also help save many more lives elsewhere.